A lead paint crisis in Milwaukee's aging public schools has forced the city to close some schools. 4 of those have still not reopened. And testing has uncovered some children have been exposed to high levels of lead, which could impair their cognitive development. The city's health commissioner has sounded the alarm and is seeking help from the CDC, which so far has not come. In tonight's interview, we are joined by Milwaukee's health commissioner, Mike Totoraitis. Mike, thanks for being with us. Let me start with how's your team doing on taking care of these schools?
It's been quite the journey. This story started back in January, and we really hit the ground running to investigate what's been happening here in our schools. And it's been a specifically challenging time for our team, as many of them are parents themselves and have children in some of these schools. And we continue to navigate this on a weekly basis with the school district as we try to make the school safe again.
And among the cuts in the federal government has been cuts to the lead poisoning prevention program at the CDC. What would be happening differently if those cuts had not been made?
Right. That's a really good question. And unfortunately, we lost the support that we had received from the beginning, really, of this investigation and enforcement action here in Milwaukee. And we had staff from the CDC who are the national experts around lead contamination and lead hazards for children. And that support is gone. On April 1st, we were notified that the team that had been working with us on a weekly basis since the beginning had lost their jobs with the CDC.
So, Mike, no one's on the phone? I mean, literally, if you call the feds, there's nobody there.
There's no one there. And unfortunately, part of that reduction in workforce that happened then denied a formal request called an EPI-aid for staff to be sent to Milwaukee to assist us in this crisis. So not only do we lose those national experts, but we also lost any formal support of a staff or a team coming to Milwaukee.
And what has the Secretary of Health and Human Services said about this?
Well, it's interesting because on the beginning of this story back in April, when the layoffs happened, the secretary was asked on April 3rd if the team had been erroneously eliminated given the significance of lead hazards in our country. And he had mentioned that there might have been an error in that team's elimination. Unfortunately, we have not heard of any reinstatement of those staff. And then just yesterday, I was getting texts from colleagues across the country asking me to turn on an appropriations hearing, and heard the secretary mention that there was a team on the ground here in Milwaukee and that there was funding coming to the city for this crisis. And neither of those pieces are true.
Wow. Okay. Before I lose you, Mike, what's your advice to other local health officials who might face this kind of situation?
I think one of the pieces that we have to constantly think about is our public health system here in our country is geared around support at different levels. And there's a role at each level of the government to support each other. I think we're entering a very challenging time where we don't have good information about the shifts and changes at the Health and Human Services, and specifically within the CDC. And there will be more public health crises beyond infectious disease that our country is going to face. And we are going to be in a very difficult position as public health leaders across the country responding to the mandates that we hold to protect our jurisdictions.